Hi, I'm Dr. Anand Guru. Today I'll show you the technique how to insert a chest drain by Seldinger technique. So before you proceed, you need to know what the indications for a chest drain are. So the commonest indication is pneumothorax, pleural effusion, and empyema. And there are numerous causes for each of them. So the items that you need for the chest drain procedure are a sterile pack, sterile gloves, chloropep sticks, 10 ml syringe, 1% lidocaine, orange needle, cream needle, chest drain kit. For securing the chest drain, either a suture or a drain fix, or you could use both. We tend to use both in our hospital. Sample pot, create the samples, and also a chest drain tubing set, chest drain bottle, and some sterile water. Now I've just laid out what's in the chest drain pack, and I'm just going to show you what's in them. So you've got the syringe. You connect that with the needle. Okay, and you can remove the cap. It's got a guard that helps you to you can mark it as per the depth from where you got the aspirate. You've got the dilator, that also has got a guard, and you can adjust it as per the depth. Got the scap, that's the chest drain tube, and this is the guide wire. Normally what I advise is just retract this guide wire slightly backwards so that it's just at the tip. It's much easier to insert it, and I'll show you when we actually do the procedure. Got the three-way tap. You just close that off and you can actually connect this out here, and that's how you prepare that three-way tap. So current guidelines recommend that you must use an ultrasound to mark the best spot for your procedure before you proceed. Now, the area where you'd insert a chest drain is called the triangle of safety. The landmarks is as follows in this mannequin. So, if you imagine that this was the armpit, so that's the anterior and that's the posterior end. So, anteriorly it's the lateral border of the pectoralis major. Posteriorly is the lateral border of the latissimus dorsi. Inferiorly it's the upper surface of the fifth rib, and superiorly it's the base of the axilla. So that would be a triangle. This will minimize any injury to the vital organs. But obviously you would use an ultrasound over this area to find the best spot to avoid any unnecessary complication. I'm now going to show you the actual procedure on the mannequin. Now, you would begin first by cleaning the area with antiseptic solution. So you break it, you press over the area, and with circular motions go around. I'm just trying to avoid going over the same area. Ideally, it's advised to do it at least 2 to 3 times over the same area. Now, once you've let it dry off, you can apply the drapes. So we've got this drape which has got a hole. So I'm going to remove that and stick on over our marked area. And then you can peel that off to secure it further. After that, you have your 1% lidocaine, and you what you do is wherever you've just marked the site, you just go underneath and try to raise the bleb and insert skin. So you want the patient out sharp scratch, go in, aspirate, and then you inject the anesthetic solution. After you've raised enough area, you change the needle to a bigger green size needle, and then just what you do is you go in, and ideally it should be just above the rib on the upper surface to minimize bleeding and hitting the intercostal blood vessels. So as you go in further, you aspirate and you inject further local anesthetic, go in further, and once you get the fluid like I'm getting it now, you don't advance any further, you retract back slightly, anesthetizing the tract very well. After you've done that, you take your chest drain kit syringe with the longer size needle. You can use the guard to mark how deep you had gone, and then adjust the depth. After that, same area, you go in and you're aspirating as you're going in. So once you get the fluid, you don't advance any further. Take the syringe up and then have the guide wire to insert. Like I mentioned, the tip, as you've just retract the guide wire, it's much easier. Then you advance it there and then just advance it inside. Just be careful to keep an eye on the end of the guide wire as you're advancing it. After this, you retract the needle and make sure you hold the guide wire all the time. Now you can give a small incision. Just be careful not to cut the guide wire. Have some gauze with you at this time, as it might sometimes bleed. And now you insert the dilator. Again, look for the end, grab it, and just go along the track, and it should be quite easy to advance. Do not advance too deep unnecessarily. You can always check that the guide wire is free, as sometimes if you use too much pressure it can kink. Okay, after that you can remove your dilator. Usually fluid can start gushing out during this time. You have your chest drain. Insert the guide wire, and then what you do is you retract the guide wire so that you can see the end coming out from this tip. You can see it's up to here for now. Now once you can see the tip, grab hold of it and then advance your chest drain tube through it. Okay. In terms of how far you should advance, there is markings in chest drain tube. As you can see, this one's marked at 9. Ideally, I would say 12 to 14 would be in a normal size patient. 12 ideally. So once you've reached desired marking, now you can remove the guide wire and have your three-way tap ready. Remove this on that and connect your three-way tap immediately. Make sure that this is closed off, and for that, turning it this way will make sure that it is currently closed off. Now we need to secure the chest drain, and for that you can use suture. Yeah. So you can use the suture to fix it, okay, and the other thing I wanted to show you was the drain fix that we use here. It is quite easy to use. So you can see that there's a small hole and it's cut open there. So what you do is you align how you'd like it. So obviously you'd remove this adhesive tape when you have to put one in. I'm not going to do it for now, just but once you've done that, you can squeeze this in and just towards the hole. After that, you peel this off completely. We can do that. So peel this off, stick it out there, and then peel this off there, and that can just go over it, and this just secures it very well. I would recommend suturing as well as using a drain fix, as this just avoids the chest drain being accidentally pulled out, and as from experience, certainly using both, I've never actually seen a chest drain being pulled out or fallen off. Once you've done this, you've fixed it, you need to remove your drapes as well. Okay, we can do that, and you'll be connecting it to the tube set.